You can take all the tea in China.
Hi,
Put it in a
this
big
is
brown
Friday,
bag
May
for me.
18th, and I'm on a quest to visit the Esquimalt Health Centre where the practice support program coordinators, Amanda and Merlin, who have been involved with the mental health module in the past, are presently working there, and I am hoping to talk to them, ask them a few questions, and get a few tips, pearls of wisdom on how coordinators can help and can work well with the team leads to deliver a mental health module that will be valued and work well. So here we go. Hi, Amanda.
Hi.
And hi, Ryan. Thanks for being here today for a question and answer session about the role of coordinators in the mental health module, running it and setting everything up. And before we start, this is an example of one of the rooms that we use mainly for catch-up sessions for people who weren't able to make the session, and we would run an abbreviated session in this room to get everybody all the credits and bring them up to speed with some of the activities from the previous learning session. So Amanda has been a helper and has helped run some of our mental health sessions, and I'm going to ask Amanda a few questions, and we'll see what comments and pearls of wisdom she can pass on to us. Amanda, how do you decide on the dates of the learning sessions?
So we work with the peer mentor, so the GP champ.
Right.
We work with them to identify the dates that first of all work for the presenter.
Right.
And generally we also try and think about the group of physicians that we're inviting and what time of the day or what day of the week might work best for them. So that's probably our first consideration, is just trying to find times that physicians have to take the least amount of time out of their practice. And then we usually try and book the sessions about 6 to 8 weeks apart so that the physicians have time in between the learning sessions to do some of the, try some of the new tools that they've learned in the learning session itself.
Right. And Amanda, I think over the years that I remember doing them, we had three different times during the day that were tried. We had the early morning one, the afternoon one, and we even had a few evening ones. Mm-hmm. What's been the most popular timing part of the day for running the events?
I would say we generally run most of them early mornings and try and finish the sessions by lunchtime so that the physicians can be back in their offices for the afternoon. We do have the luxury here in BC of being able to support the physicians to attend the module sessions, so they are compensated for their time out of practice. So I think that's why it's been feasible to do it during the day. But if there is an alternate funding model where they might not be compensated for that time, then I would suggest an evening event.
Yeah, and they roughly run from 8 in the morning until 11:30 in the morning.
Correct.
Yeah, great. Any particular favorite days of the week or days that work better than others?
Again, I think that varies city to city, town to town. We have probably found that Wednesday mornings are the best for physicians, that we tend to avoid Monday and Friday.
Right.
And a lot of people away or just really busy coming back to work on a Monday morning. So I would say midweek.
And when you're running a session, do you normally run them on the same day for the three sessions, the same day of the week?
We try to.
Yeah.
That definitely maximizes the likelihood of people attending and just having that consistency.
Is it hard to get everybody rounded up to attend? And
it can be. We do have quite a good system in place where we obviously send out the invitations with all 3 learning session dates ahead of time. We have a pre-module visit with each attendee where we again go over the 3 learning session dates and get their commitment that they will be there. We send a 1-week reminder ahead and a 2-day reminder. So It does involve quite a lot of organization to get people there, but we're very successful with that.
So you contact them roughly about 4 times for each learning session. Good. Yeah, I get it. It's good to know. Like for maximum attendance, and you know that helps make the sessions better. Obviously, you know.
Yeah.
What about finding a suitable place, setting it up, and organizing the logistics of the presentation, the center, you know, the food, look, things like Wi-Fi, all the equipment. How do you go about that?
So what we try and do first is work with the GP champ to decide what the right amount of people will be for that session. So we generally end up about having 20 to 25 GPs plus their MOAs. So that really will dictate what venue we choose based on the size of the group that we need to accommodate. Once we know those numbers, then we will go ahead and book a venue. We tend to end up in a hotel most of the time. We try and have it be a central location so that people can get to it relatively easily, somewhere where there's adequate parking and that there's catering and audiovisual support in place as well.
Great. Well, that sounds like you know, you've sussed out a few suitable places, and
Yes.
I think I remember some of the good places that you picked.
Yes.
We've had the sessions though in a lot of different places.
Yeah,
Any-
and we've tended to kind of go back to the same place for a while now,
Right.
mostly because of its central access and wide availability of parking.
I remember we had one session up at the Canadian Armed Forces in their officers' mess, which was really
was that neat?
fun
Yeah,
and interesting. I think that was before your time.
Before
but-
my time.
Yeah. So what about setting up the agendas? You know, figuring out what the agenda is going to be for each learning session. How do you do that?
So we have some content that is provincially developed and accredited and already divided into the 3 learning sessions. Within those slides, there is some flexibility though. So we work with the peer mentor. We have planning sessions. So we generally have a planning team with 1 or 2 coordinators and the peer mentor. And maybe sometimes a specialist would come along as well, depending on the content. And we would work together on setting out an agenda that incorporates adult learning principles. And what I mean by that is we don't just want 3.5 hours of didactic slide after slide, that the wealth of knowledge in that room is really what needs to be shared. So we ensure that the agenda has breakout sessions where there might be some table talk discussions or case discussions. There might be some role playing, even things like a scavenger hunt we've done before, but things that make learning fun and maximizes the knowledge that's in that room so that there's time to share.
Yeah, well, that's and I remember all of the these things that do make it fun, and it does bring out cheering and gets people talking, and that helps, I think, to make the session all the more valuable and the learning at a higher level.
Absolutely.
Just a couple of questions. What about all the emailing and reminders and keeping everything organized? Do you have an organizing, formula?
I think every coordinator likely approaches it a little bit differently.
Right.
But what we've found here in our office that works really well is we've developed a checklist, which is divided into kind of the planning ahead of time, and then the session, what needs to happen before the session, what needs to happen during the session, and what happens after the session. And it's very clear in that checklist whose role it is. And we put timelines beside each of those things. So leading up to the sessions, we know what jobs have been completed, what still needs to be worked on, and we're in constant communication with each other to ensure that all of the T's are crossed and I's
Yeah.
are dotted.
So you brought a checklist here with you
I
today.
did.
Would you mind sharing it
Sure.
with us?
I'll put it down here, so
All
maybe
right.
that's better.
So can you explain how this works?
Yep. So these are, you can see the first steps here that I would work with our admin coordinator and perhaps one of the other coordinators to look at whose role it is, what day it needs to be completed by, and then a checked off section whether it's been done or not. And then as we lead up, we send out the invitations and we RSVP, and then we prepare the venue ahead of time. We ensure that there's the adequate communication with all of the attendees, as I've mentioned. We put the packages together for the day of the event. And then there are certain administrative jobs that need to be completed after the session as well. So it's quite a big list, but that definitely helps to keep us organized.
Would you be lost without that list?
I would not be lost without that list. I'm one of those people who keeps it all up in here, but I do think that it helps. It helps to, when you're working as a team,
Yeah.
To be really precise about whose job is what.
Yeah. Amanda, the pre-module visit is something we started doing after a few different sessions, and it's been very well received. Can you give us a little debrief on the pre-office visit?
Pre-module visit.
Yeah.
Yeah. So as part of our RSVP, when physicians reply saying that they'd like to attend the module, we send them an email to ask for some time to come and visit them in their practice before the module starts. And the purpose of this visit really is to set the expectations for what they are signing up to. Generally, this can be up to 6 months of their time, and so it isn't just a one-off couple of hours education session. This really does involve quite a lot of work on their part and some changes in practice. So we ensure that the physicians are really clear about what the learning objectives are for the sessions. And at this point, once in a while, physicians might actually change their minds and say, you know what, maybe this isn't the right time for me, or this isn't lining up with what I thought the expectations were. So that really has saved us quite a bit of time by doing those pre-module sessions ahead of time, ensuring that we have the right people attending. The other part of that session is talking to them about their action plan and their action period work, which are two different items that we ask them to complete during the module. So their action plan, I refer to this more of their personal goal for taking the module and what they want to achieve. That really relates to where they are in practice and their comfort level with treating mental health conditions. And their action period work is more of a provincially set standards that we anticipate that each physician would try during the module itself. So it's, for example, we might request that they try 4 PHQ-9s or 4 GAD-7s with their patients through that, between that first and second learning session. And so if they haven't had experience with those tools, this is their opportunity to do that. So we make sure that they understand that work will be required, and that really does help to also begin the relationship that we have with the physicians. A lot of our roles as coordinators really coaching them through that work. So really valuable time to spend with them.
And being the GP champ, bringing some of these stories and some of the questions and some of the pearls of knowledge that come out of these visits, we bring them to our next learning session, and it gets some of these are good questions. They get collaborated upon at the next session. Everybody can weigh in as to how the best way to solve some of the challenges that these physicians have.
Absolutely.
Have you noticed, or have you any example of a good story of something like that happened?
I would say, trying to think of something specific that's happened through that. I would say what happens often is we do provide that opportunity for the physicians to talk about what it is that they want to know and want to learn through the module. Maybe it's specific questions around medication or resources in the community. And if we know that it's not going to be covered through the module, then we have that opportunity as coaches and coordinators to link the physicians up with those resources. So that's a real success that can come from having those one-on-one visits. And it might also be that the physician needs a bit more one-on-one support from the peer mentor themselves, the GP champ. So sometimes we might also arrange that as a follow-up session to further support the GP to manage those patients in practice. So I think it often is that asking the question to give the physician the time to think about what it is that they really need in order to feel confident about managing this in practice.
Yeah, that's a really good point. Just kind of looking back on all the sessions that you've been involved with, and if you were to think about the things you've learned and maybe pearls of wisdom, things that you may have not have been aware of initially, but through experience and trial and error, you actually overcame some challenges and develop some ideas on how to successfully and smoothly run these programs. What are the top 3 things that come to your mind?
Okay. I think number 1 that comes to my mind is flexibility.
Right.
So taking that feedback that you hear about what the needs are of the group and adapting the content so that you can weave those needs into the presentation itself. So that flexibility, I think, is really key. I think also using the wealth of knowledge that is in that room to its maximum potential. I love that the GP champ doesn't necessarily have to be the be-all and end-all in terms of knowing everything about managing adult mental health. They just have to facilitate good conversation in the room.
Right.
And so really remembering and focusing on the fact that every person who's there comes with their own experiences and their own wealth of wisdom to share.
And harnessing all that.
Absolutely.
Yeah,
absolutely. And I think for me as a coordinator, it's just being really present for the physicians and trying to identify how we can support them so that they do increase their confidence and use those coaching skills to keep them progressing on their journey.
And everybody in good communication.
Yes, absolutely.
Through them.
Yeah.
Great. Well, great words of wisdom. We really appreciate your experience and all the tools you've shared here. And I'll be passing this on to our friends and colleagues in Nova Scotia. Thank you,
Great.
Amanda.
Thank you.
Amanda, when the sessions are over and we collect evaluations of the session, what do you do with them?
Good question. So we collate all of the responses from everyone who's there. They're all anonymous. We group them by GP or medical office assistants to try and get the feedback from the different groups. And we do enter all of that information in a spreadsheet because it does capture the pre and post session skills and whether they have been enhanced. Mostly, though, those responses are shared with the GP champ and the rest of the planning team, and they are used to inform our next learning session. So if there is a request for less didactic or a certain area that we maybe didn't go into enough depth about, and there's questions around a certain topic that we covered but still questions that were left, or even the style of presentation that if we have feedback, good or bad, we do share that with the GP champ. And that's good for everybody's learning.
Yeah, no, it's great. Do you have any examples of the evaluation forms with you, or?
I don't have them with me today at the
But
table, but I
bring
have
them.
and I'll make sure that you
Perfect.
have them. Yeah.
Great. Well, I think they'll be useful to share because they are a guide, and they do help. They do give us honest feedback, and doctors can be brutally honest, and we appreciate that. And it's good having the good and the comments that where we could have done better, we pay more attention to and try and rectify that at the next session. It also helps, I think the group take ownership of the sessions because they're now adding content and value to the next session.
Absolutely.
And that helps tie it all back together again. I think it makes them more personalized and more valuable. Yeah.
And that's the quality improvement part of what we do.
Yeah.
That we are constantly trying to strive to make every session better than the last.
Yeah. Thanks, Amanda.